Hi, I'm Laura, registered chiropodist, and I wanted to talk about first MTP joint injuries such as Hallux limitus and Hallux rigidus. The first metatarsal joint is supposed to have a certain amount of range of motion, dorsiflexion. And when that doesn't happen, there can be jamming and irritation and trauma that happens to the joint, which can lead to osteoarthritis in that joint. Typically, people who have a lot of kicking, so soccer players, football players, can get trauma to that joint, and they can get injuries, Hallux limitus or Hallux rigidus. When we're walking, we are supposed to have, or running, this first ray is supposed to plantar flex so that this joint can dorsiflex. If that mechanism doesn't work, then this bone ends up dorsiflexing, and that jamming can happen, leading to this problem in the joint. What do we do for this issue? Well, symptomatically, sometimes we can get the pain under control with topical anti-inflammatories, rehabilitation, so making sure the contributing factor leading to this biomechanical areas is addressed, such as if there's lack of range of motion in the calf, if there's lack of strength, if there's lack of foot strength, addressing all those factors. And then sometimes what we like to do is give a carbon plate insole or a rigid carbon extension so that the toe doesn't undergo as much jamming that happens. I firmly believe as well in glute strength. Okay, so addressing the mechanics and the kinetics from the upper chain, making sure that that's not causing any abnormalities in our foot landing because of compensatory muscle groups or tightness happening. If the pain doesn't respond with rehabilitation, reduction of load and carbon plate insoles or a carbon plate shoes, then we can move to, or a rocker bottom shoe we call it, then we can move to steroid injections as long as there's enough joint space. If it's too far gone, then steroid injection is not necessarily recommended. If the pain is continuing despite the best efforts with conservative care, we can move to steroid injections as long as there's enough joint space there. If there's too much arthritis, steroid injection may not be a viable option. And if that doesn't work, then there's surgery. So there's a procedure called a chylectomy that goes in and can help reduce some of that abnormal bony growth in the joint. Steroid injections do help along with the physiotherapy. Most people can have pretty good results with the steroid, corticosteroid injection into that area. However, if it's quite painful and the bone is really proliferated, unfortunately, sometimes the best solution is surgical intervention. So that if people, even if they have arthritis, as long as we work on strengthening and restoring the proper mechanics, people can live a healthy, active lifestyle with occasional flare-ups or a low grade of pain. And it is something that is manageable and definitely treatable.